A child's health and well-being should be given the utmost importance through a holistic approach for proper physical, mental, and emotional development of the child. A child is not an adult in a small body, and the medical needs of a child are very different from that of an adult. Parents who are alert and sensitive to their child's responses and quick to take appropriate care can help their child grow healthy and be free from several of the ailments that may occur during childhood. Aster CMI Hospital, with one of the largest pediatric departments, having the latest, most sophisticated state-of-the-art pediatric facilities, with a team of expert pediatric specialists from various subspecialties and super specialties, offers holistic healthcare for children to help them attain their maximum potential in life.
Pediatrics is a complex specialty. It can be compared to the process of metamorphosis, where the caterpillar becomes a beautiful butterfly. The needs of the larva, pupa, and butterfly are very different, though we are addressing the same insect in different stages of development. Likewise, the needs of a fetus, newborn, child, toddler, and an adolescent are completely different, though we are talking about the same individual at different stages of development. And to have all the subspecialties to address each and every system of these children is a magnificent feat which the pediatric team at Aster is trying to achieve. I am confident with all our super specialists and specialists at Aster, we can cater to every need of each child walking into Aster, whether it be physical, mental, social.
A child at Aster CMI Pediatric Department remains under the watchful eye of the very concerned and specialized staff 24/7. One of the unique features of the Pediatrics Department is the dedicated Level 3 PICU and NICU, where advanced critical care is provided for children and neonates.
The Pediatric Intensive Care Unit at Aster CMI supports not only medical intensive care but also surgical intensive care and also transplant intensive care for children who have undergone solid organ transplant and bone marrow unit as well. All the other subspecialties of pediatrics will require support of pediatric intensive care at some time, and all these critically ill children are looked after by the PICU team here at Aster CMI. One aspect of PICU is also promoting and preventing healthcare issues which happen in children. With that respect, we do also work in the community level for child safety and nutrition. So these are other things that as an intensive care team we do to reach out to the community in pediatrics.
We have a 14-bedded pediatric intensive care unit which caters to all the sick cases in pediatric age group. We have other pediatric intensive care unit which also supports the transplant program, which involves the bone marrow transplant as well as the solid organ transplants. We have a pediatric trauma team which look after all the trauma cases, and hence our outcomes in the trauma cases are very good. Our infection control department is active enough and make sure our infection rates are at its minimum. We have other support systems like pediatric psychologist, pediatric nutritionist, pediatric physiotherapist, because of whom our outcomes in the pediatric ICU is very encouraging.
At Aster CMI Bangalore, we have a scope of giving comprehensive neonatal care in our unit. To highlight on that, we have a Level 3 NICU care unit which is well equipped, which contains conventional ventilators, high-end ventilators, incubators, nitric oxide delivery system, therapeutic hypothermia units. The major thing is we have a dedicated skilled nursing staff as well as 24 register cover. To highlight on the comprehensive care, apart from the neonatal care, we have fetal medicine department who do fetal interventions. We have a pediatric surgery department which caters for neonatal surgeries. We have pediatric cardiology backup, neurosurgery backup. As a part of neonatal department, we also cater for parental services where we associate with fetal medicine department as well as the obstetrician in antenatal counseling of high-risk deliveries, including the congenital diaphragm hernias, tracheal fistula surgeries, as well as we are also involved in cardiothoracic department as well as the cardiologist. So where we cater the high-risk newborns. Apart from these services, we also have neonatal transport team which is well equipped ambulances with ventilators and incubators, which can retrieve the sick babies from far off places and deliver the best services what is required for our sick kids.
Empathetic treatment of every child under the supervision of expert staff makes Aster CMI the most trusted name when it comes to pediatric care.
The Department of Pediatric Immunology at Aster is involved in the diagnosis and treatment of complex immunological disorders in children. A group of conditions called primary immune deficiency disorders are being regularly diagnosed at our unit. These are a group of children who come to us with repeated and unusual infections, and we not only provide diagnosis to these children but offer treatment. The bone marrow transplant unit at Aster is very active in treatment of these complex immunological conditions. On the other hand, the Department of Pediatric Rheumatology also is involved in treatment of complex rheumatological conditions like Kawasaki disease, systemic lupus erythematosus, and various forms of vasculitis. The Department of Pediatrics at Aster CMI believes in the philosophy of providing comprehensive care to all the young souls that come to us, and we promise we'll treat you well.
The Department of Pediatrics at Aster CMI Hospital offers the whole spectrum of services for children and adolescents, which includes pediatric emergency and intensive care, neonatal intensive care, pediatric surgery, pediatric immunology and rheumatology, pediatric oncology and hematology, pediatric bone marrow, liver and kidney transplant, pediatric cardiology and cardiothoracic surgery, pediatric neurology and neurosurgery, pediatric gastroenterology and hepatology, pediatric pulmonology, pediatric urology and nephrology, craniomaxillofacial surgery, ENT and ophthalmology. With the help of state-of-the-art technology, the wonderful team of specialist pediatricians offer treatment solutions for basic to critical ailments all under one roof.